Hello. Our project is going to be doing DHEA, and it is done by David Johnson and Douglas Winzenburg.
What is DHEA? DHEA is a steroid prohormone, and it is an endogenous steroid generated by the adrenal glands and ovarian theca cells. The DHEA in its sulfate phase or state is the most abundant steroid within the human body naturally. We don't have to actually put it there. Our body does produce it naturally, and it's the most abundant. They are indirect precursors to the androgen and estrogen that our body produces, so it can be metabolized to these different ones to then therefore get to the testosterone or estrogen.
So, who would use DHEA? Anyone who suffers from anxiety, immune deficiencies, muscle spasms, erectile dysfunction, poor ovarian response, or sexual dysfunction.
Some effects that we found while researching DHEA are that it can reduce stress, help with the immune response within our body, cause vasodilation, which can help correct erectile dysfunction or sexual dysfunction. It helps with smooth and vascular muscle relaxation. And like I said before, it is a precursor to the testosterone and estrogen within our body, which can therefore increase the sexual function. The adverse effects that we found was mostly due with the testosterone or estrogen within our body and the effects that has. So it's the acne on the skin. You have that more oily skin or oily hair, and then the body hair will increase in growth on the patient that is taking this.
So, is DHEA similar to another drug? Kind of. It's like we said, it's more of a precursor to the testosterone and estrogen. However, it is pretty similar to a neurosteroid, and you might get some similar effects. So, what the evidence says, one of the effects of DHEA is that it can reduce stress. The positive psychological states from DHEA are normally related to the reductions in the hypothalamic, pituitary, and adrenal gland activity, and that its reaction to stress. So basically, the DHEA reduces this HPA activity, which causes the positive effect to help moderate stress and also can lead to some immunological benefits as well. We also found that DHEA can help the immune response. So it can increase the IL-2 concentrations. It can also stimulate the T cells and the natural killer cells, which result in a improved immune response. It could also be helped in the treatment of asthma with the bronchioles and kind of like the vasodilation effect as well. And then unfortunately, more research is needed in human subjects. There's a lot of research done in non-human subjects, but more research is needed for a more definitive result. There is also some evidence that DHEA could be used as an antidepressant. So since it acts as a neurosteroid, it can be an indirect precursor of several neurosteroid hormones. So it is possible that alterations in the neurosteroid levels within the CNS could contribute to some of the antidepressant effects of DHEA.
What we found with vasodilation with DHEA is it just activates the potassium channels, and then it can enhance the endothelial function and ultimately dilate the arteries within the body, and that can correct different things such as erectile dysfunction. Evidence has suggested that DHEA can help with sexual function. It has been shown to significantly improve oocyte numbers, day 3 embryos, and higher clinical pregnancy rate in those with a poor ovarian response. There is no significant improvements to the basic characteristics of the ovarian response or ovarian reserve, but there is that with that higher clinical pregnancy rate with it. It's thought to affect the early follicle maturation by regulating the androgen receptor transcription. It increases follicle stimulating hormone receptor expression, and then it modulates the follicle-stimulating hormone activity in the granulosa cells, which then increases the number of growing preantral and small antral follicles, helping with that poor ovarian response and that increased clinical pregnancy rate. DHEA has been shown to increase testosterone in women and men as well as estrogen levels, but most of the studies have focused on the testosterone level within the body. But there are more consistencies with men with these levels. Some say that it greatly improves, some say that it doesn't improve enough to where you can see an effect, and then others say there's even like a slight decrease in it depending on the way the study is set up. It has been shown to improve the desire, sexual arousal, lubrication, orgasm, and satisfaction from taking it, and this is mostly within the female population. Within the male population, there are inconsistencies shown with erectile dysfunction, because erectile dysfunction does have psychological aspects to it, that even with a DHEA treatment or supplementation, it can fix the physiological, but that psychological still exists, so then it's not completely resolved, and that could be a limitation to the studies that have been shown. So it's just inconsistent with the erectile dysfunction treatment. We found a study on the menstruation cycle. It was a 12-month treatment of DHEA, and it found no effect on the premature ovarian insufficiency, which happens within like 1% of the population. Within this population, there is no resumption of regular menstruation after DHEA supplementation, so it does not help with this at all. Our recommendation, we would say that the evidence does show benefits for those who have sexual dysfunction over healthy individuals. So if the person is suffering from sexual dysfunction, it may be beneficial for them, and it may be something to try. It may help with poor ovarian response and improve the clinical pregnancy rate, as well as more oocytes or healthier oocytes. So it could be beneficial in regards to producing the pregnancy in a woman. Some more research does need to be done just to show that there is a consistent benefit rather than most inconsistencies. But most studies do show that benefit now. Regarding erectile dysfunction, studies have been inconclusive on this. There have been some benefit for it, some inconsistencies, and some it does not help. So more studies just need to be actually completed and show that benefit or not a benefit to see if it can be used for that treatment.
So DHEA has been shown to help with anxiety, depression, and improving immune function. But again, more research is needed, so I might be a little bit hesitant to recommend this to family, friends, etc. However, we did find a study that said that short-term exercise greatly improves DHEA levels. So we would both recommend trying short-term exercise first before we incorporate putting any additional supplementation into the body that isn't definitively going to help. So we would recommend just trying exercise first, and then hopefully that improves the DHEA levels, and hopefully they get the benefits of DHEA without actually having to take this supplementation. And these are our references. Thank you for your time.